If you've been feeling jittery, losing weight without trying, or constantly overheating, you might be ignoring signs of hyperthyroidism. This condition occurs when your thyroid gland produces too much thyroxine, a hormone that regulates your metabolism. Overproduction speeds up bodily functions, leading to a wide range of symptoms that are often mistaken for stress. Menopause, or simple aging. According to the American Thyroid Association, hyperthyroidism affects approximately 1 in 100 people in the United States, with higher prevalence in women over 50. Early detection is key, as untreated hyperthyroidism can cause serious complications such as heart rhythm disorders, osteoporosis, and even heart failure. Let's take a closer look at 9 scientifically proven warning signs of hyperthyroidism. Explained in detail. 1. Rapid heartbeat or irregular heart rhythm. One of the earliest and most serious signs of hyperthyroidism is a consistently high heart rate, even while at rest. This happens because excess thyroid hormones increase beta-adrenergic receptor sensitivity in the heart, making it more responsive to catecholamines like adrenaline. 6. The heart's workload is elevated, increasing the risk of atrial fibrillation, AFib, a type of irregular heartbeat associated with stroke. In fact, the Framingham Heart Study indicated a 5-fold increase in AFib risk among hyperthyroid patients. Many patients feel a strong pulse in their neck or chest, and may even experience skipped beats or palpitations. These symptoms are not just uncomfortable, they are dangerous. If persistent, they can cause cardiomyopathy, a weakening of the heart muscle, which may become irreversible. 2. Unexplained weight loss. Despite normal or even increased food intake, people with hyperthyroidism often lose weight rapidly. This is due to the elevated basal metabolic rate, BMR, which causes the body to burn calories faster. A clinical report in Thyroid Research, 2023, showed that hyperthyroid patients lost an average of 4 to 10% of body weight within 3 months of onset. Muscle wasting also contributes to the weight loss, as the body begins breaking down protein for energy. This is particularly dangerous for older adults, as it may lead to frailty and decreased mobility. Weight loss in hyperthyroidism is typically accompanied by increased appetite, making the mismatch between intake and weight even more alarming. If left untreated, the body may also enter a catabolic state, affecting liver and kidney function. Doctors often look for this clue in patients who report eating well but still shed pounds without trying. 3. Anxiety, irritability, and insomnia. Excess thyroid hormone affects the central nervous system and heightens sympathetic activity, leading to increased nervousness and reduced tolerance to stress. In a 2024 systematic review published in Endocrine Reviews, more than 70% of hyperthyroid patients reported anxiety and emotional instability as their first symptoms. These individuals often describe being on edge, experiencing racing thoughts, and having trouble falling or staying asleep. Sleep deprivation only amplifies other symptoms like fatigue and mood swings. The impact on sleep and mental health is profound. A Journal of Clinical Endocrinology and Metabolism study showed that untreated hyperthyroidism increased the risk of generalized anxiety disorder by 40% in older adults. Emotional outbursts, panic attacks, and irritability, even in typically calm individuals, are common and may be misdiagnosed as psychiatric disorders. That's why mental health symptoms in midlife or older adults should include thyroid screening as part of the diagnostic process. 4. Tremors and muscle weakness. Fine tremors in the hands, often mistaken for caffeine jitters, are another early sign. These tremors result from overstimulation of the peripheral nervous system. The Mayo Clinic Proceedings, 2022, detailed that up to 65% of hyperthyroid patients experience noticeable tremors, especially when extending the hands. Alongside this, muscle weakness occurs due to protein breakdown and impaired neuromuscular transmission. Proximal muscles, such as those in the upper arms and thighs, are most affected. Patients may struggle with everyday tasks like climbing stairs, rising from a chair, or lifting groceries. Over time, if the condition persists without treatment, muscle atrophy can develop. Importantly, this weakness is not due to lack of exercise but to the catabolic effects of excessive thyroid hormones. 5. Heat intolerance and excessive sweating. A hallmark of hyperthyroidism is heat intolerance. Patients report feeling overheated even in cool environments or sweating excessively during minimal exertion. This stems from the thyroid's role in regulating thermogenesis, the body's heat production. A 2023 article in Journal of Thermal Biology highlighted that increased T3 and T4 levels elevate core body temperature by increasing mitochondrial activity in cells. Night sweats are also common and may disrupt sleep. Because the hypothalamus receives signals of increased metabolism, it falsely believes the body is overheating and initiates sweating to cool it down. The constant sweating can also lead to dehydration and electrolyte imbalance, compounding fatigue and muscle weakness. 6. Irregular menstrual cycles in women. Hyperthyroidism disrupts the balance between estrogen, progesterone, and luteinizing hormone, LH, leading to menstrual irregularities. In premenopausal women, periods may become lighter, less frequent, or stop altogether. A meta-analysis in the Journal of Reproductive Endocrinology, 2024, found that 55% of women with untreated hyperthyroidism experienced menstrual changes within the first 6 months of symptom onset. The condition also reduces fertility by interfering with ovulation. These effects can often be reversed with proper treatment, but persistent imbalance may lead to long-term reproductive issues. Women over 40 are especially vulnerable to misattributing these changes to perimenopause. Delaying diagnosis. 7. Bulging eyes and eye irritation, exophthalmos. In Graves' disease, the most common cause of hyperthyroidism, inflammation affects the muscles and tissues behind the eyes, pushing them forward. This symptom, called exophthalmos, is present in up to 50% of Graves' patients. According to the American Academy of Ophthalmology, patients may notice a staring appearance, dryness, light sensitivity, or a gritty sensation. Severe cases can lead to vision problems and even corneal ulcers if not treated. MRI scans show increased volume in orbital tissues, likely due to autoimmune-mediated swelling. The condition is not only a cosmetic concern, it may signify an aggressive immune response affecting other parts of the body. 8. Thinning skin and hair loss. Thyroid hormones regulate the growth cycle of skin and hair cells. In hyperthyroidism, increased turnover leads to brittle hair, diffuse hair thinning, especially on the scalp, and fragile nails. A 2023 study in dermatoendocrinology observed that 78% of newly diagnosed hyperthyroid patients had visible hair thinning or alopecia areata patches. Skin may become warm, moist, and thin, making it prone to bruising or infection. Some patients develop red rashes or hyperpigmented patches due to increased capillary fragility. These signs often precede other symptoms and are an important visual clue for clinicians. 9. Frequent bowel movements or diarrhea. Excess thyroid hormone stimulates gastrointestinal motility, leading to more frequent bowel movements and, in some cases, diarrhea. This doesn't necessarily mean watery stools but more frequent and urgent defecation. A study published in Gastroenterology Reports, 2025, found that hyperthyroid patients had an average of 3 to 5 bowel movements daily. Even without dietary changes, this rapid transit time reduces nutrient absorption, particularly for fat-soluble vitamins, iron, and calcium. Chronic diarrhea can cause fatigue, electrolyte imbalance, and unintended weight loss. These gastrointestinal symptoms often improve quickly once thyroid levels are normalized through treatment. Hyperthyroidism may start subtly, but its long-term effects can be serious if left unchecked. The signs we've discussed, from heart palpitations to hair loss, are not isolated symptoms. Together, they point to a deeper metabolic disturbance that can be identified with a simple blood test. If you recognize more than 2 of these signs in yourself or a loved one, don't ignore them. Early diagnosis and treatment, including medication, radioactive iodine, or surgery, can restore balance and prevent complications. Be proactive, talk to your doctor, and take control of your thyroid health before it controls you. See you in the next video. Bye.